Hi, thanks for joining us for day 2 of our Tareen Dermatology Lunch and Learns. I'm Dr. Tareen. This is my colleague, Kelsey Holmes, who's our wonderful physician assistant here at Tareen Dermatology. Our Tareen Dermatology Lunch and Learns. Today we are going to be talking about hand rashes, how to take care of your hands with all the hand washing and the sanitizing. We'll talk about eczema in kids and adults, which presents as kind of these itchy rashes. And then we'll talk about a condition called psoriasis, which does tend to be a little bit more widespread and resistant, and what we can do in these days to prevent our patients and all people from going on these immune suppressing medicines, so to keep our immune system healthy in the face of COVID. So let's start with kind of the skin barrier, and how to keep it healthy during everything that's going on. So we as dermatologists like to think of the skin as a brick wall. So the skin is composed of corneocytes, which are these dead skin layers that protect the top. So the bricks are actually the skin cells. The white, the mortar, if you would say, between the skin cells are the lipids, the fats and the proteins that keep the skin together, the cohesiveness of the skin. So what happens when you're washing your hands all the time, when you're applying a lot of chemicals, the mortar, the white between the brick wall actually breaks down. That allows then two things to happen. Number one, when this mortar breaks down, foreign chemicals, proteins, bacteria, and in this day, viruses can get in and they can infect the skin. Number two, water that's trapped inside. We want good water to hydrate the deeper layers of the skin. The water can get out, it evaporates out. So you have like a two-faceted thing. Protein, bacteria, bad chemicals get in, and water getting out. That can lead to all these cracks in the skin, the redness, the pain, and the inflammation. So we are going to talk today about our top 10 tricks to keep your skin healthy during the COVID epidemic. Number one, Kelsey's going to start with number one.
I forgot our numbers. So. The one thing that we recommend is making sure that we are turning down the water temperature. The CDC has done some testing to figure out what exactly will kill the virus, and water temperature does not seem to affect it. Really hot water will definitely open up the layers of your skin a lot more and let a lot more of that water out of your skin. So turn down to the temperature to a lukewarm temperature, and just make sure that you're doing the recommended 20 seconds of hand washing to help combat the virus.
So we'll have these top 10 listed after for all of our followers and viewers, so you don't have to remember them. Just kind of get the gist of the message. Number two, our next tip to keep your skin healthy and your hands healthy during this time is to use gentle, non-soap based cleansers. So a lot of us, especially given my age growing up, we'd always use those bar soaps to clean our hands, and those tend to be more irritating because they're at a different pH than the normal skin. So we as dermatologists like these creamy cleansers, things that say gentle, hydrating, cleansing. They still will remove bacteria and viruses, particularly if you do, enough lather, but they will not change the pH, the basic balance of the skin. So these are some really great brands that are very hypoallergenic. You want creamy, very gentle. If it can say hydrating on it, that would be great. At this time, since we are using so much hand washing, if you can put away your bar soap, that would be preferable.
Number three tip, this is a huge one, is to make sure that you're putting your hand cream right next to the sinks where you're washing your hands. As soon as you can reapply a barrier hand cream after you open up those pores, the better it works and the less dry your skin is. When you're looking for a moisturizer, you want to make sure that you look for a few different ingredients that will help to rehydrate the skin and also help to re-put that skin barrier back on. Some key ones that you want to look for are glycerin, hyaluronic acid, dimethicone, urea, lactic acid, cocoa butter, shea butter, and ceramides. There are lots of different products available that have some or all of these ingredients, And again, we'll list these so you can see them on the website. One of our favorite brands is the CeraVe. It is named, funny, the pronunciation is actually CeraVe because it stands for Ceramide Vehicles. They were one of the first companies to kind of figure out how to put the ceramides in the cream to make it usable for people.
And our probably one of our favorites, and we're not paid by the company, trust me, you can look on our paid disclosures, is this one, the CeraVe Moisturizing Cream, and particularly in this day and age is this therapeutic hand cream. It says on it dimethicone. Dimethicone, as Kelsey said, is a protectant. It actually helps feed and repel water from the skin. So patients always ask me, if I'm using dimethicone, will I still get clean? Will the bacteria and the virus come off? Yes, it allows the bacteria and virus to go away, but repels water from getting into the mortars, from getting into the white lipid bilayer of the skin. So this is a great one. Cetaphil makes some good ones, but dimethicone is a great barrier to prevent water absorption. Let's go to tip number 4. That is, this is actually a good one. You don't necessarily need to do it all the time, but particularly now while we're washing our hands all the time, it's great to get into the habit of using gloves when you're doing dishes or doing scrubbing the toilet or all those things we have to do at home now that we're at home all the time. A lot of us just wash our hands after we do our household chores, but now because we're getting the double hit of washing our hands all the time and doing all those household chores, you might want to invest in a good pair of nitrile gloves, but be sure to remove them because then they do trap kind of more water in and can dehydrate your skin over time. So afterwards, great, after you take off your gloves, rinse with some cool or lukewarm water and then put your hand cream on right away. Moving on to tip 5.
The 5th one, this is again one of my favorites. I will tell patients every single day that it's a key time right before you go to bed to slather your hands up with your preferred cream and to make sure that while you're not washing your hands overnight, the cream can really get in there and soak in. A good way to do this, and I do this quite a bit during the winter because I tend to get hand eczema, you can do an at-home spa night where if you soak your hands in kind of lukewarm water for about 5 minutes, take them off and pat them dry. Don't scrub real hard to dry them off. Pat them dry, put a good thick layer of your cream on, and then wear cotton gloves if you're able to overnight. I also tell my patients when I was younger, I had to do this all the time because of my terrible eczema. In a pinch, you can also use like cotton-based socks. You obviously don't have dexterity, but it does help to keep the medications on. I have 2 things on my bedside and all the time. One of them is a moisturizer called Amlactin that has a little bit of that lactic acid in it, and the other is Aquaphor. Those are the 2 things I use every single night to try to help keep this at bay.
And it sounds so posh when you say at-home spa night. Moving on to tip number 6. This is something that we should be doing during this age of getting so much bacteria and virus. We should be removing our rings because the rings and the jewelry trap the soap underneath them and cause a prolonged kind of irritant dermatitis. So when you are really hand washing, it's good to probably keep your rings aside and just revisit them later or maybe wear them around your neck.
Number 7, this is a good one too. This is something that people don't always think about, but adding a humidifier to your bedroom can make a really big difference for dry skin, hands included. The dry Minnesota winters are the typical time that people pull out their humidifiers, but if you're prone to eczema, it may be something that's worth using year-round to help hydrate your skin. You should be in your bedroom 6 to 8 hours a night sleeping if you're a good rule follower. And that's a lot of time to get some nice humid air and help your body kind of attract that moisture into your skin.
Yeah, we have, we're lucky to have a whole house humidifier, but I still try to keep a humidifier in the bedroom just because my skin is so dry. And beyond just like keeping your skin hydrated, also good for how you look because as we age, if your skin is more, you get more moisture, you look more plump and youthful. So if you're not even in it for functionality, you can be in it for looks, Tip number 8 is do not forget your nails. Your poor nails can be an innocent bystander with all this hand washing and hand sanitizing. And people often get these ridges in their nails, and it's actually due to nail dryness. People always forget that your nails, just like your skin, can get dry. So a little tip that we as dermatologists use is to, before bed, put moisturizer all around your cuticles, because your baby nail, your new nail, comes in underneath here. This is the manufacturing part of the nail. So if you really focus your moisturizing effort at this base, the new nail that comes in will be nice and healthy and moisturized.
Tip number 9, use natural oils. We get questions all the time about what are some natural products that we can use. Some of these have been studied relatively well, and one of the better ones is sunflower oil, avocado oil, and coconut oil. They all have some anti-inflammatory and soothing properties to them. We don't recommend using olive oil. This one can actually make some people's lipid barrier a little bit worse because of the low amount of linoleic acid that's in it. But there are good easily found oil substances that you can use as moisturizer.
On that note, sometimes people think that natural things are great, and natural things are great, but some of these people can be even allergic to natural things. So we see patients who are allergic to shea nut, coconut, those types of things. So maybe before you put it all over, you might want to try that little trick that we talked about yesterday. Just put it a little bit in the crook of your arm for a few days. Make sure you don't react to it. But sunflower oil tends to be very unreactive. That would be the first one to try. Tip number 10. This is a good one that Kelsey and I really believe in. It's that diet plays a big role in skin. A lot of times people forget that if you're not getting enough protein, enough good fats, that all of your skin will suffer. So your skin is made of protein and also that lipid, that fat membrane. So we want our patients to make sure they're getting their fish oils, getting their nuts, their avocados, all those good healthy fats to keep your skin healthy from the inside as well. We see it all the time, like when our patients go through like gastric bypass or they have a major illness, their skin gets worse, it gets fragile, and it ages. So make sure you're getting your good nutrients. Awesome. Let's move on. Let's talk a little bit about more medical things. Sometimes if your skin gets really bad and it's not just dryness, it verges on a condition called eczema. Kelsey, you want to talk a little bit about eczema?
Yeah, as I said, I have had eczema since I was a young kid. Eczema is a pretty general term that basically means you have a rash on the skin. There are lots of different types of eczema that are out there, but it's always safe to, eczema, a lot of it's treated the same. And basically what happens is that there's a combination of genetic and environmental factors that disrupt that skin barrier. And so some people have it their entire lives because it's more of a genetic thing. Other people will develop it because they're getting, exposed to kind of caustic substances like cleaners or things like that. But there are a lot of different types, and some of the types can show up on different areas of your body. But hand eczema is really common. One of the more common reasons that you may develop eczema, as Dr. Tareen said, on your hands, that irritant eczema can actually be a very big thing where water and soap are getting trapped underneath of rings, or the big one. And then from there, it can actually start to spread across your hands. So it may start under your ring, but it can certainly spread further than that. The other thing we see are allergies to things. This is always a tough one to figure out. Sometimes it's very obvious that, every time I use this cleaner, my hands get terrible. But a lot of times it's not obvious, and it's not always necessarily a cream you're putting directly on your hands. It may be something you're touching, inadvertently, metals and different preservatives that are in all types of different creams and things like that. So we actually, if you have a type of eczema that just isn't getting better, and we can't figure out what it is, we do what's called patch testing. This is a particular type of allergy test. We have a little photo of what this looks like. But this is a particular type of allergy test where this is not what your allergist does, where they poke you to test for dogs and cats and pollen. This is a particular type of test where we put substances on stickers on your back usually, and We test for 80 different chemicals. There's a panel that gets together every couple of years, and they decide what the most common allergens are for people that are in North America. And so we test for all of these common allergens to try to determine if you have a true allergy to something that you're touching every day.
Some of our most satisfying experiences are with patch testing because we can really mitigate and help people's rashes and impact their lives. Like, I have this wonderful patient who's a nurse, hopefully she's watching right now, I love her so much, and she had unexplained rashes on her neck and kind of around here, and she'd been to many dermatologists. At Tareen Dermatology, we finally patch tested her, and she ended up being allergic to the only thing of the 80 things was blue. And we're like, what is it? She's like, I don't wear jeans, I don't wear blue scrubs. It ended up being she was allergic to the blue in the dye of the gloves at the hospital because they only use blue gloves at her hospital. She asked to use clear gloves and she has almost no rashes now. I had a music player who had chronic rashes around his lip. We thought maybe he was allergic to his instrument, which would be detrimental to his whole career. We patch tested him. He was allergic to propolis, which is in beeswax. And we're like, she told me he didn't use beeswax around his mouth or on his instrument. You know what it was? He was applying Burt's Bees chapstick, and that, once he stopped that, his lips were fine, he could play again. So, I mean, I'm sure you've seen those successes as well. So.
Yeah. There are certain industries that are more prone to developing allergies. So hairdressers and anybody that works in salons is a notorious industry where you are exposed to certain types of chemicals so often that you develop allergies. But little known too, people that work with cement all the time, different metal workers are also people who will eventually develop allergies. So it is something that's relatively common in certain industries. Nurses are another big one because they're touching a lot of somewhat caustic things all day long.
And people always say, like, I was never allergic to that before, but these allergies develop as these chemicals get into that skin barrier. So I was never an allergic person, but as I've gotten into middle age, trust me, it comes on. Let's talk a little bit about eczema in kids, because as you were saying, Kelsey, it does, you saw it when you were a kid. Eczema kind of runs on my husband's side of the family, so I see some patches in various of my many children. What are your favorite strategies for eczema in kids, Kelsey?
I think one of the most important things is to reassure parents that, that the eczema affects everybody. So especially when you have really young kids, it can be tough when babies are babies.
Yes.
And parents have a lot of fears and worries. And one thing I always try to reassure my patients of is that bathing your baby is okay. So a lot of people will try to avoid bathing because they think it's going to dry out the skin and make it worse. But as we talked about with a spa night at home, as soon as you are done bathing in, relatively cool water, just make sure to slather your kids in cream. My kids both know, and they both get very minor eczema, but they both know when we're out of the bathtub, it's time to put cream on.
Right.
And we just head to toe just slather them and everything.
I agree. And they actually did a really great study, a randomized study where they did moisturizer in babies 0 to 6 months of age, like religiously, just like Kelsey and hopefully my kids, versus just like sporadic moisturizer. And the babies in the moisturizer every time after the bath group from 0 to 6 months of age developed much less eczema through the rest of their lives despite a genetic preponderance towards it. Because by building up that skin barrier when you're a baby, it helps prevent the cracks in the mortar of the skin, just like we were talking about. So lots of good strategies for kids. And as parents, we take so much guilt, and if your kid's eczema is flaring, it is not your fault. We are happy to see them and help them, and there are a lot of non-steroidal based things that we can do too. Let's quickly move on to psoriasis, which is a similar inflammatory condition, but sometimes can be a little bit more widespread. And then we have a couple demonstrations that we're going to do today and a few little patient testimonials too. So people often think that eczema and psoriasis are the same, and they're actually totally opposite ends of the spectrum. Eczema is more of, internal, maybe allergic mediated, worsened type of thing. Psoriasis is a genetic disorder of the skin that causes excessive growth of the skin. So psoriasis can present as these red, kind of scaly plaques, and typically we can see psoriasis elbows, knees, scalp, those types of places, but it really can come everywhere. The problem with psoriasis is it's not just a skin disorder. It can affect the heart. It can cause depression. It's really a multi-system disorder. So, we've got lots of these medicines that are called biologics, and these medicines help reduce the immune system so you can get less of those, skin issues, etc. But they do reduce the immune system. So a lot of patients are coming to us saying, I do not want to be on a medicine that interferes with my immune system because it increases my risk for COVID, cancer, other infections. So as dermatologists, we've got this awesome therapy called light therapy and excimer laser therapy. Excimer laser and light use a beam of light. And this technique has been around for almost 100 years. We started using light therapy in 1926. What it does, it reduces the overgrowth of the skin and reduces the inflammatory cells in the skin. So the skin, it kind of clears up. You can see that these are just some of our success stories. Like this gentleman literally was in pain and he could not walk. And this before and after happened almost essentially just with light and topical medicine. He did not have to take anything internally. This gentleman, you can see how thick his plaques of psoriasis with that characteristic silvery scale was before. And this is just after light therapy without ever having to take anything internally. So I have a couple patients here. If you guys can go over to Erin and Julie.
Yeah.
Erin Messer is my colleague in light therapy. She's going to come tell you a little bit about it. You want to talk a little bit about light?
Yeah, so
We can ask some questions.
light is really safe, and Erin will show you as she's coming in here. Light is super safe, and it works on that and we have a very kind patient who's willing to come on our show.
Yeah.
Should we go forward?
Yep. And this is our laser technician, Erin.
Hi.
And she and Julie are going to talk about the experience.
Yeah, so Julie, just tell us a little bit about your experience, kind of how long you've been with us and what your outcomes have been.
I think I've been here over a year, and when I came here I was really like, oh, what's gonna happen, what are they gonna do, oh my gosh. I come here, rock stars, you're all rock stars. You made it so easy for me to come here and get my treatments, and I'm just like, anything I ask you girls, you know, yeah, you were just like, here you go, and I'm like, okay. I literally, everybody I talk to, if they say, oh, I've got this, oh, you gotta go to Tareen Dermatology. I can't say enough goodness about everybody that I've come in contact here.
Aww.
Julie.
Aw, Julie.
I've only dealt with girls so far, and that's okay. Kelsey, oh my God. Dr. Tareen,
Oh,
oh
Julie.
my gosh.
Oh my gosh, we love you so much.
We love Julie. Erin, tell us what you've been treating Julie with.
Yes, so we have been using a combination of the eczema laser, which is right behind us, in addition to our full body phototherapy, which I'd be happy to show everybody in a little bit here. The laser behind me uses a specific wavelength of ultraviolet B light. So it's, like I said, a specific wavelength, kind of filters out all of those other harmful wavelengths, which helps to overall mitigate the side effects and overall risk of skin cancer, which is really important to know. It is a targeted therapy, so another benefit is that we just treat the affected areas and healthy skin is not treated. And then with the full body phototherapy, in addition to being good for treating more widespread conditions, it also helps to keep new spots at bay, so it's helped with overall controlling the severity and frequency of Julie's flares, and she's been doing really, really well.
Awesome.
Yeah, we love to hear it. Yes.
And exactly what I was talking about. You asked her something and boom, there was the answer.
She's a smart cookie.
And it was so easy to understand. It wasn't these big, huge words that you're looking like, okay, I'll look that up. But yes, and this is how I deal with everybody that I've met with. It's just like, man, this is so easy.
Oh, good.
It is so easy. And like I said, I am blessed to be amongst you women here. I was supposed to be here, I think.
Aw.
You
Well,
know?
this is the best thing about our light therapy center is that we all become good friends. That's the best part about it. So, on that note, Julie is going to choose 2 things from here that
Are you serious?
anything you want. Anything you want. They're all safe for your skin too. Take anything you want. And we'll talk about our winners from yesterday too. But first we have one other patient where light therapy has changed his life.
Yes, 2.
Do we have our friend Mike
on the phone, yeah. Hi, Mike, are you there?
I am here.
Okay, we're gonna hold your picture up so we know who's talking.
Friend Mike.
Okay,
So Mike, can you kind of give us a rundown of what you have gone through here at our clinic and everything like that as well?
Oh, sure. Well, I've had eczema for about, and I call it eczema, not eczema. So you can call it whatever you want, I guess. But I've had it for 60 years, and about 5 years ago, I was at another doctor doing some stuff, and he took a look at my eczema and said, "You need to go see Tareen Dermatology, Dr. Tareen, in Roseville, and have her take a look at this eczema." And so I did, and what happens is I got an appointment with Dr. Tareen, and she put together a treatment plan for me, and it included the UVB light treatments, and that's something new to me. I didn't know they existed, but I started them about 5 years now, and it's incredible what they've done for me. My eczema was, along with the regular spots behind the knees, ankles, wrists, and everything, my eczema was all through my trunk, my stomach, and everything. And so I started the UVB treatments, and within about 3 to 4 weeks, I think it was, and of course they build you up, I had my skin healed up, and it smoothed out and stopped scaling, and that's what eczema does. And then it also, the best part of the whole deal was that it stopped itching. So for the first time in my life, I think, since I've been a little kid, I actually could sleep at night, and that was that's a big deal for me, because I had a lot of trouble sleeping with being so itchy. So Tareen Dermatology and the clinic over there in Roseville has been super. I started with 3 treatments a week, and now I do 2, and it's been fantastic. I just wanted to, shout out to the eczema sufferers out there.
No, that's great, Mike. We really appreciate you letting us call you today.
Yeah,
Thank you so
Sure.
much for this. This means a lot.
You bet.
All right.
Thank you, Mike.
Thank
We
you.
love you.
Thank you, Mike.
See ya. Bye-bye.
Bye-bye.
We're running low on time. Exciting. But we want to go through our winners we drew from yesterday, who are going to get a full-size product that will get mailed to them and magically appear at their door. We have Denise Moore, Chelsea Branham, Vicki Cummings, Nicole Theis, and Linnea Patrick Anderson. So they will be getting full-size products. Every day that you log in, 5 people will be drawn in their name will be read the next day. And then on our last day, we have entire gift set worth $270, $280 of anti-aging that if you've logged in every day that you will be eligible to get. Before you leave, we've got a couple questions, and I also just wanted to show you the light therapy booth so you can see how non-intimidating they are.
All right. So just walking through here. So there's our little computer to where we put all of our dosings and stuff, and then the patient can go into this little booth here. Looks like a tanning bed, but it is
Erin has them in the
good
booth.
one as well. Okay, perfect. So then we'll go over here.
This is a tour of our cute little phototherapy department. So this is literally what it looks like going in the booth. So it is a 360-degree
covered in bulbs head to toe. So like I said earlier, really, really good for more widespread conditions and also for keeping new spots at bay, so for controlling those flares. Appointments are super fast. Julie just steps into the booth. She's going to demonstrate. And
Vanna White today.
and then we have some goggles on for eye protection. And then we have the doors shut. So like I said, 360 degrees. It is open at the top though, so no claustrophobia at all. Right, Julie? Nice and easy.
Exactly.
And how long are you in the booth for, Julie?
4 to 5 minutes.
Yeah, so it's super fast, really easy for, busy parents, working adults, anybody to be in and out of here very quickly, and so easy to work into the beginning or end of your day, at your lunch break, whenever. They're super easy and really great for you.
Awesome. Thank you.
We don't have too much time, so we'll do some quick questions, guys. We'll go back to our question room. Kelsey and I can answer. Go ahead with our questions, please.
Yes, the first question. Someone's father-in-law was diagnosed with psoriasis, and they said he was told to go tanning. Is that another option, or is that not something you recommend?
As dermatologists, we typically don't recommend tanning because of the increased risk for skin cancer. These bulbs that are used in phototherapy have been proven to not increase the risk of skin cancer because they utilize a very narrow spectrum of the light. So in tanning beds, you get broad spectrum light that helps psoriasis but also increases your skin cancer. These bulbs, A, they may just treat targeted areas. B, if you're doing it all over, it only is a narrow spectrum that does not increase your risk for skin cancer. What do you say, Kelsey?
Same thing. Anytime I have a patient who's tanning, using a tanning bed, I highly discourage it. There are other options that are out there. If you live in the middle of nowhere and don't have access to a phototherapy center like us, there are other options. So we certainly recommend talking to your dermatologist about those other options. And it's just not worth the risk in terms of increasing your risk of melanoma, which is a very deadly skin cancer, to treat the psoriasis. There's other things that work better.
Are you still doing these phototherapy treatments during the COVID outbreak?
Yes. We consider phototherapy and eczema laser an essential medical service. The reason why is if our severe psoriasis and eczema patients get worse, they may need to be put on an immune suppressant, which would then significantly increase their risk for COVID. So the American Academy of Dermatology and the prevailing dermatologists in America have deemed this to be essential for critical people. If you have just a spot of eczema, obviously we're not making people come in for light therapy for that. But for our patients with more severe eczema and psoriasis that would otherwise need an immune suppressant, heck yeah, we are open.
Do you want to do one more, or do you want to end it?
Pardon?
Do you want to do one more?
We'll do one last question.
Okay, perfect. Jen wants to know if patch testing is just for adults or kids too, and how long are those patches on?
Excellent question. Go ahead, please.
It is a process. Most allergic reactions show up somewhere between 48 and 72 hours after the exposure to the allergen, which is part of the reason why it's hard to pinpoint what might you be allergic to. And so the process usually is that we put the patches on Monday, you wear them through Wednesday, you come back into the office, we take off the patches, we make sure that all of the markings stay where they are so we know where everything was, and then we actually have you come back in on Friday and do a final reading. We have done patch testing on kids, especially if it's something that we think they are highly allergic to. Sometimes with kids it can be a little bit more of an involved process because sometimes their back isn't quite big enough to fit all of the patches on. But otherwise it is something that we do consider.
Great. So I hope you had a great educational experience. We are here if you need anything, and we'll post our top 10 tips. And thank you to CeraVe, La Roche-Posay, Vanna Cream for getting full-size products that we'll be mailing to our winners. Thanks.